If you are suffering with consistent lower neck pain, mid-back pain, and you work at a desk, you've tried stretching, some exercises, and the pain keeps coming back, this video is for you. I am Dr. Craig Selinger, chiropractic physician. Today we are here with Crystal. She's a patient in our office, and she's a desk worker. She works all day at a computer, and she's been suffering with lower neck, mid-back pain. We've been working with her for some time now, and we get a lot of patients that have mid-back and neck pain due to being a desk worker. And Crystal, we've been working with you. We've given you some home exercises and stretching, and also made some other recommendations for you for using a support brace at work. How's the treatment been going? How's the support brace been working for you?
Well, I love coming to my treatments, so every week I look forward to it. But the back brace has been a very big help at work. I tend to hunch over a little bit. I tend to get on my elbows a little bit, and the brace kind of forces me to sit up. It forces my posture to straighten out, and I find that my back is in less pain throughout the day over the course of the week because I've been utilizing it a bit more.
Awesome. So today what I'm going to do is I'm going to show you what we do in our office to treat Crystal. We're going to do a chiropractic adjustment. We're going to do a little bit of deep tissue work in the lower neck area and the mid-back area. We're going to do some stretches. We're going to do some strengthening exercises. I'm going to show you the brace that we recommend, and stay tuned because at the end of the video, we're going to give you some home exercises to do that are a little bit more advanced than some of the ones that you might have tried in the past. So we're going to adjust the mid-back area right here. All right. Good. Awesome. When somebody's working a lot on the computer and they're in that forward flex position, they're going to have mobility issues in the spine very often in the mid-back area. So we do the chiropractic adjustment, help mobilize that area, get the movement restored and the alignment as well. And then we're going to be adjusting the lower part of the neck as well. Sorry for my cold hands here. Good. Awesome, very good. I'm gonna have you lay on your stomach, please. Right. All right. Face me on your side this way. Perfect. Good, I got you. Okay, good. All right, come on up. So, what we're gonna do is we're in this area of the neck, levator scapula is in this area, traps, some other muscles as well. When we have that forward head position, it is, these muscles get really tight. We develop trigger points. We're gonna use our scraping instrument. We're gonna do some instrument-assisted soft tissue mobilization on these areas here to help with getting those muscles to relax and just loosen up a little bit. Right here, just kind of. You feel that a little bit?
Yeah, I'm sure you feel that.
Good. Great. And what I'm going to do is have you bring your head this way, back, and then forward like that, okay? And go. Good. And go. Good. And go. So, Crystal, you do a lot of work with animals too, right?
Yeah.
And you help people that are moving, or they want their pets to be maybe going across country or long distances.
Yeah.
So, wow. So you drive a lot too. So
Yes,
you're in the car a
exactly.
lot too. Wow. That's cool.
Some people, pets are their children. So.
Oh, yeah. I'm going to do this one again. Ready? And down. Good, and down here. What we're gonna do is work on the rhomboids a little bit. We're gonna do an active release technique for the rhomboids on this side. What I have to do is put your arm up like this and around underneath the table like that, you okay? And up like this and down like this while I'm going, okay? Ready? Bring it up, and good, and down. Keep going, good, and up, and good. And with some pin and stretch technique to try to bring up and down, get some of the muscle tightness out of these of the rhomboids. Good. And let's work on this side now. and up, and down, and up, down. One more. We're gonna do some stretching to increase mobility, and I'm gonna be guiding her through some of these stretches. So the first stretch that we're gonna do is we're gonna have the patient put their hands behind their neck right here, and we're gonna come all the way back in the chair, and we're gonna come back like this, bringing the elbows out, breathe out, good, and then come forward, good, and back, that, great. One more, and back, good. Okay, we would do this about 10 repetitions in the office, and this is something too that patients can do at home, okay? The next exercise that we're gonna do the chin tuck, but I'm actually gonna help guide her through the movement. So the chin tuck is a movement where all day when we're like this, it's the reverse. So we're gonna do cervical retraction, okay? Cervical retraction, straight back. And we're gonna tuck the chin this way. We're gonna bring the chin back, and I'm gonna stabilize in the back of the lower neck area. Good. Good, like that. So what we're doing is the chin tuck, and I'm helping push that end range of motion, get more movement, get more mobility. This is something that it's hard for a patient to do this at home. We would do this with patient as well. The other movements that we're gonna do, we're always gonna be recommending to do lateral flexion, both ways, and I'm pressing. And what we wanna do is help get the patient to the end range of motion, and as far as we can, both sides. Good, and then forward flexion, head down, great, and head backward. Awesome, really good. Okay, we're gonna now work on an exercise using TheraBand, and we're gonna do chin tucks with the resistance from TheraBand. And you can get these, we'll have a description down in the notes below. In the description, we're gonna have some affiliate links, which means they're Amazon affiliate links, which means we could receive a small commission from any sales of the product. And what we're gonna do is have the patient put their head around the TheraBand like this, and then do the chin tuck, hold for 2 to 5 seconds, and back, and hold, and back. And you can even pull slightly and go back, creating even more resistance in the band. You could also use a pillow laying down or against a wall to get resistance to do the chin tuck. Really important to strengthen those muscles that are involved in when you're typing all day as well. Okay. Put this around. Do this. Put it up slightly like that. And you're gonna pull it forward. Yep. And then bring your head back. Great. Good. Great. Okay. Very good. All right. So I mentioned that I was going to give you some home exercises, home stretches that you can do that are a little bit more advanced, I think, than a lot of other exercises and stretches that we've done before. One of the ways that you can stretch is bring your hand, put it underneath your leg, kind of towards your butt a little bit, and you're going to, when you do the side stretch for your traps here, you're going to bring the head and you're going to lean a little bit, and with your hand and arm anchored, you're going to get a little bit better stretch for the traps. The other stretch that's really important is for the levator scapula, and with the hand behind this way, you're going to get a better stretch. You could also put the hand behind the back as well and do it that way. See where you're going to feel the stretch the most. It's different for different people, and that's another stretch for the levator scapula. Doing all of your stretches with overpressure, meaning that you go to the end of the range of motion and then just push back slightly. You're doing that with all the ranges of motion here. So we did the yeses, the nos, and then the side bends. And we do that, all those with overpressure. Those are some great stretches you can do for the neck area. And last but not least, stretching around like this for the rhomboids, stretching like this, around for the rhomboids, like that. You could even bring your chest out, hands behind your back, shoulders together and apart like that. Those are all really good exercises and stretches for you to do at home. Now, we spoke before about a brace that can be used while you're working at a desk or if you're driving a lot, that can help you be able to sit in that position without having a lot of pain. And it takes time to build strength in your back and the spinal muscles. And to give you a bridge until you get your strength that you need in your neck and in your back, I recommend this particular brace. It's Help Crystal, and we're going to show you that right now. The thing that I like about this brace here, again, and we'll provide this in the show notes below, in the description, affiliate link for this particular belt on Amazon. It is affiliate link like I spoke about before. We might receive a small commission for any sales of the product. Now, it has some support in this area, in the mid-back area, and what it's going to do is just help bring your chest and up like this, help support the mid-back through this area where it'll prevent your shoulders from rolling forward. And if your shoulders roll forward, your head's gonna have a tendency to go forward, which would create pain here, here, and here. A lot of people complain of after sitting, they get burning pain in this area and here. I think this is a good belt to use, not to wear forever. This is not a forever brace. This is something that you can wear if you have to be at your desk for a while and your muscles have not fully developed to help you sit in a position and strongly be able to stay in that position naturally without the use of brace. So when we build our strengthen the muscles in the spine and so this area, we're going to be able to sit longer. Our muscles are naturally going to be able to give us a posture that's going to support our spine, and we're not going to suffer with a lot of pain. So strengthening those muscles is going to help us, but this is going to help us be able to do the job, be able to work while we're developing those muscles, while we're strengthening those muscles and doing that, okay? So that's why I like this particular support belt. We're gonna now work on some strengthening exercises that we've reviewed, and they could be done with exercise tubing. So what we're going to demo is the face pull. This is an exercise that's great for the rhomboids and a lot of the muscles in the upper back area, lower neck area as well. So what we're gonna do is have some tension in the tubing, bring this towards the face, like that, okay? Yep, it's this good view, and you're gonna bring it, yes, great. Good. Great, how does that feel?
It feels
It feels good. It feels like you're working those muscles, great. The next one that we're gonna do is called the Y, and we're gonna get close. We're gonna get tension in the band, and all it is just holding back, making that Y position, holding that Y position, relax, holding if you can for up to 5 seconds, back, holding, and back. Up, and good, hold, 1, good. Great. Great. Okay. Awesome. Now we're going to do 2 more strengthening. We're going to do standing row, coming back like this. Okay. Similar to the face pull, but just a little lower. Last exercise that I'm going to recommend with the tubing is for external shoulder strengthening. A lot of people have rolled shoulders like this. And when their shoulders roll forward, it's a natural tendency for their head to come forward. By strengthening the muscles, external rotators, the strengthening that we're going to do this way, we're going to help to bring the shoulders out this way and bring the head and neck back like that to make it a more natural position, a more natural posture for you to be able to sustain that better posture. So what we're going to do, we're going to take a towel, we're going to put it right in our elbow and where our ribs are, and this, we're going to bring this tubing a little bit above the hip. We're going to start out here and we're going to go here, right here, small movement, hold, 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 and that would be done for at least 10 repetitions. You can work up to 2 to 3 sets every few days. That's also a great exercise for other shoulder conditions. Now, we went over a lot of stuff today in the office, stretching for the mid-back, the neck area, and strengthening. However, this video is for educational purposes only. It is not intended to replace going to a chiropractor, physical therapist, or your primary care provider, or any other health practitioner. These are some things we do in our office that helps our patients. I hope you enjoyed the video today, and if you have, smash that like button and subscribe. Let us also know if there's any topics that you want to learn more about. Please feel free to leave them in the comments. That's it for today, and have a great day.